Don't panic if your tomato leaves look like this. Some tomato diseases look almost identical, but treating the wrong one can waste valuable time. Today, I'm going to show you how to identify the most common tomato diseases by looking at a few simple clues on the leaves, stems, and the fruit. By the end of this video, you'll know what to look for, how to tell these diseases apart, and what you can do to manage them. And before we finish this series, I'm going to test you with a mystery leaf from my own garden. Before we identify diseases, I want to give you a simple system that will make diagnosis much easier. So whenever you notice something wrong with your tomatoes, ask yourself 5 questions. Where did it start? How big are the spots? What's inside those spots? Are the stems or the fruit affected? And what has the weather been like? We'll use those same 5 questions throughout this video. So let's take a close look at this leaf before I tell you what it is. What stands out to you? The first thing that I notice is lots of tiny circular spots. Now let's zoom in a little. Notice that many of these spots have gray or tan centers, and inside those centers are tiny black dots. Those little black dots are one of the best clues that you're looking at Septoria leaf spot. Septoria usually begins on the lower leaves and gradually works its way up the plant. It can also infect the stems, but it rarely affects the fruit. This disease thrives during cool, wet weather. You want to remove infected leaves, clean your pruning tools between plants, and you want to treat with a copper fungicide according to the label directions. Here's a quick guide so that you can identify this in the future. Tiny circular spots, gray or tan centers, tiny black dots usually affect leaves and stems, but not the fruit. Now compare this leaf. The spots are much larger. If we take a close look, you'll notice target-like rings inside the lesions. Once you've seen those rings a few times, they're kind of hard to miss, and they're one of the quickest ways to tell early blight from Septoria. Early blight can also infect stems and fruit. Usually the stem lesions look the same as the lesions that you see on the leaves. Large, dark, sunken lesions often develop near the stem end of the tomato. And notice this blackened fruit stem with white mold beginning to develop. That's another clue many gardeners overlook. Early blight usually starts on the lower leaves and it'll spread its way upward during warm, humid weather. So your quick ID for this one is large lesions with target-like rings commonly affects fruit. So let's make a quick comparison. Septoria has many tiny spots with gray centers. Early blight has fewer, much larger lesions with target-like rings and commonly affects fruit. Late blight is one of the most destructive tomato diseases you'll ever encounter. Unlike the previous diseases, it can appear almost anywhere on the plant. So let's study this leaf. Notice that the lesions look water-soaked instead of dry. Now, when you turn the leaf over, you often see white fuzzy growth underneath. This is one of the strongest clues that you're dealing with late blight. And those little white spores can be carried by the wind and spread very easily. So you always want to make sure that you notify your neighbors if you have late blight in your garden, and you want to notify your local extension office because this is a very serious disease that can take out your entire crop in just a couple of weeks. One thing you'll notice is that fruit often develops greasy looking brown patches. And if you do confirm late blight, you want to remove infected plants promptly and protect nearby healthy plants with labeled fungicides. So your quick ID for late blight is water-soaked lesions, white growth underneath the leaves, and greasy fruit lesions. Early blight usually begins low on the plant and has dry target-like rings. Late blight can begin almost anywhere and produces water-soaked lesions with white growth underneath the leaves. At a first glance, this looks very similar to Septoria, but notice the spots stay dark instead of developing gray centers. Tiny, dark spots also appear on the fruit, and they're usually only about 1/16 of an inch in size. So you want to treat this with a copper-based bactericide because this is bacterial-based rather than fungal-based. Now compare that with bacterial spot. The fruit lesions are much larger, rough, and often scabby. Leaf spots will often have a greasy appearance, and this disease prefers warm, wet weather. So let's compare the first 4 that we've been over. Septoria has tiny gray-centered spots. Early blight has large target ring lesions. Late blight has water-soaked lesions with white growth. And bacterial diseases have dark or greasy spots with fruit symptoms. One thing to note on the bacterial speck is that even though it does have those yellow halos, you won't see that tan or gray center like you do with Septoria leaf spot. So that is one way you can tell the difference between your bacterial speck and your Septoria leaf spot. So far, we've looked mostly at leaf diseases. So now we're going to look at diseases that affect the whole plant. One of the first signs of Fusarium wilt is yellowing on only one side of the plant, or sometimes just one branch. Eventually, the whole plant will wilt and decline, and this one leads to plant death. Unfortunately, there is no cure once the plant is infected, so you want to remove the plant immediately. If you will cut open a lower stem, you'll see some dark streaks inside, and that's another way to know whether or not you have this wilting disease or if it's something else. Verticillium wilt looks similar, but the yellowing is usually more even and the disease progresses more slowly. Verticillium likes cooler weather, whereas Fusarium prefers warmer weather. These wilting diseases are pretty common, so when you choose tomato varieties, you want to look for that VF resistance whenever possible. The package will have a VF on it, indicating that it has resistance to that disease. So finding tomato disease doesn't mean that you've done something wrong. Spores blow in on the wind, bacteria can arrive on transplants, and some diseases survive for years in the soil. You want to make sure that you have good practices like watering at the base of your plant. You want to provide good airflow. You want to remove infected leaves promptly. Always disinfect your tools in between plants and clean up infected plants at the end of the season. And one key thing to remember when identifying tomato diseases is that you can have more than one disease at the same time. So if it seems kind of confusing because you're looking at this leaf and you're like, okay, well, this one looks like Septoria leaf spot. And then you look over at another leaf and you're like, well, this one has these big lesions like early blight. So what do I actually have? Well, you can actually have both of them because they both thrive in the same environment. Now let's return to the mystery leaf. Take a look at it and study it. Ask yourself the 5 questions we discussed throughout this video. The correct answer is early blight because of the large lesions and the target-like rings. The next time you notice something unusual on your tomato plants, don't panic. Start with those 5 questions and let the clues guide your diagnosis. If this video helped you, let me know in the comments which tomato disease you've battled the most. Thanks for watching, and I'll see you in the next video.